welcome back to another edition of Simply Fit. I'm your host, Sandy White. And remember, we're on a mission to save 1 million lives by encouraging individuals to live a simply fit life through health and nutrition so that they're able to overcome suicide and depression. And today's guest is, we had her last season. She's Essie Magege. But before we jump into all of that, I do want to thank WYTV7 Christian Broadcasters Network for allowing Simply Fit to be on their network for the third season. Guys, go onto the website, WYTV7.org, and check out all of the wonderful things that we're doing in the community. And while you're there, please make a small donation or a large one. Just help us to continue to bring wonderful broadcasts like this one to the nations. All right, with that being said, let's welcome Essie to the show. And I just want to remind you guys a little bit about her background. As I mentioned, she was on last season before she jumps on. She does have multiple specialties in medicine. She cares for patients in areas of internal, family, critical, pulmonary, emergency care medicine. She is the president and the chief executive officer of the All Chemicals Center of Change. And that's a wellness center that is in the heart of Manhattan and also New York City. She'll correct me on those locations once she gets on. And also, she does have a book that will be coming out hopefully at the end of this month. She'll let you all know that. But she's a sought after international speaker and she's a health coach. And the reason she's here, guys, is to talk to us more about COVID-19. Now, I let you guys know at the beginning of this season that I didn't have a sister that passed away on the 30th of December due to COVID. And what we want to talk to you guys about are the symptoms that you can be made aware of. And then Essie's going to go into a whole lot more that, you know, in the medical field, because I'm not in the medical field, what you guys should be made aware of, because we know there's a lot of confusion going on. So this is why Essie is on the show again today. So welcome to the show, Essie. How are you today?
I'm doing very well, Sandra. Thank you again for having me back on your show. And thank you, WYTV7, for having me here as well. I think you said it all. I don't have anything else to add to that beautiful bio you just.
Oh, well, thank you.
Listening to you, I was like, oh, is that me?
Yes, this is you, my love. And we are so grateful to have you on. So as I mentioned, there's a lot of back and forth going on. And we don't want to finger point. We could do that all night. And it's still not going to bring back those 400 plus million individuals that have lost their lives. What we want to do is make sure that people know what's going on now so that they can properly prepare themselves as well as their family members. Now, I do want to ask you a question on whether or not, like, I know the sprays, Microban 24, and then what's the other one, the Lysol. I know they're helpful, but to what degree, if you have some information on that, basically so people can get an idea of how they can protect themselves as much as possible from COVID, and then who's possibly at risk, because I know, and I'll repeat anything that you need me to repeat, because I know at one point they were saying the elderly, but my sister wasn't even 50 yet. And I know she had underlying conditions, but then there are some folks that are young that have underlying conditions, and they have challenging times, but they pull through it. So kind of help walk us through what we need to know about the different sprays and who is at risk.
Oh, thank you, Sandra, for that great question. So anyone who's exposed to COVID is at risk. So which includes all of us, you know, because this is a pandemic and we're all exposed to COVID. Again, the CDC really emphasized in terms of like what is close contact. So in other words, if you're in close contact with anyone who is COVID positive, that puts you at risk. and close contact is defined by if you are within 6 feet of that person, or if you are, if you are around someone who's been coughing and coughing up or droplets on you, that's considered close contact. Or if you care for someone who had COVID, those are all close contact. So anyone who is within close contact with anyone who tested positive for COVID, and that could be anybody, because how would you know who's positive for COVID, who's, out there, you are basically at risk. So in terms of like sprays and all that, I really don't get so particular in terms of like what spray, because that all depends on, because I don't advertise one product over the other. I try to stay away from that. But what the CDC advises is good hand hygiene. As long as you're washing your hands, if you contaminate, if you're touching any contaminated objects, you should be washing your hands. So frequent hand washing, and then also just being conscious of those contaminated surfaces, and also bringing contaminations into your home. So like a lot of people, when we go out on the train, we wear, our regular clothes that we wear on the train. When we come back inside the house, we go and sit in our beds, and we know that, these droplets can be passed on to our clothing, right? And we go and now sit on our beds, or we hug our family members. Those are all modes of transmission. So just bringing consciousness to that, how can I transmit this virus to one person to the other? That helps in terms of like reducing the spread. So therefore, definitely hand hygiene is one of them. Do not pick on your nose, with your hands. You see a lot of people just, out of, reflex, they're picking on their nose, on their faces, especially when being outside in the public, or going shopping, and things like that.
So that was, I like what you just said, and I did not. And I'm thinking a lot of people are not even thinking you're out and about. It's not like a neon sign says this person is infected, but it could get on your clothes. That wasn't even on my mindset. So with you sharing that immediately, not sitting on your bed, things like that, come in and change your clothes. Should we be spraying the clothes down? And do you know how long that the symptoms, or I don't even know, I'm going to say droplets because I'm not educated in the medical field to say the right term, and you'll correct me on that. But how long, if, not knowing or unknowing, droplets possibly be on your clothing items, how long does that last? Because folks don't know.
That's another great question. So what I do, my practice is, as soon as I get home, right at the door, if you can, afford that. When I say I afford that, if that's convenience actually for you, I put like not a garbage, a bin where I put my dirty clothes right at the door. So what I do is I take my clothes as soon as I get in, I take off my clothes and I put it in the bin there, the wash bin. That way I'm not bringing in anything from outside into my home. And that also helps me in terms of reducing the amounts of cleaning that I have to do in my home. So once I know that, I've cleaned my house, I've disinfected my home, I can leave my home that way for a few days without having to do that again, because I am conscious of what I'm bringing back home. So I do that too also with groceries. So with groceries that I buy from the shop, as soon as I get in, right at the door, I have a separate area where those things go into that needs to be disinfected. So that's what I typically do. I'm aware that not everyone can be able to do that, but if there is a way you can adopt those kind of practice that helps you to limit how much you bring into your house in terms of the stuff that are out there, like as soon as you get into the public setting, limiting a way to disinfect those things that you're bringing into your house, I would definitely encourage that. And then what was the other question? I know you asked me another question.
Oh, it was just how long, knowing or unknowing, you were saying with the droplets could be on your clothes, how long, because if you are not in a position to drop the clothes in a wash bin, right away, how long should you like not wear those clothes or
Yes.
touch them or something?
Right, that's a great question. And I know that the CDC has exact details onto how many, because depending on the surface area, depends on how long those the COVID virus lives on the surface. So I don't want to speak out of out of my head, but I know that on hard surface, and you correct me if I'm wrong on this, so don't quote me on this, but I know it can live up to 4 days. But they're different depending on the surfaces. But there's a lot of information, and I think that's a great information that people should research and know in terms of how many days can these viruses stay on my clothes or stay on whatever surface, whatever items that you have. And the CDC has a really great guide to guide us on that. But I know that for most surfaces, the viruses can stay up to for a few days on a surface. So it's really, really key that you are disinfected. The stuff that are coming, your groceries, you're taking off those clothes that you wear in public, and just having a way to disinfect them.
So I'm gonna jump back to the groceries. You were saying how you disinfect or clean them or something like that. So are guidelines on the CDC website for folks to know what to do in wiping down their groceries? Because I've not done that. I mean, we go get them and we literally just put them up, and that's a good idea. I know that's a lot, that's an additional step, but if it's gonna help protect you, what procedures should they be doing? Like take a baby wipe or a Clorox wipe their cans down or something like that?
Sandra, I'm trying to stay away from promoting any products.
Oh, no. Yeah, you don't have to say the name. Yeah, no.
What I mean is usually with all surfaces, it should be wiped down. You know, whether they come in the form of groceries, with clothes, we can easily wash that. But these surfaces are a way, that's one way we transmit these viruses, because they do. When you sneeze, when someone who has COVID, you know, the way we pass on COVID to one another is through droplet and also through airborne. That's what the studies are saying. So in other words, you know, someone sneeze, that's how they shed the virus, right? By sneezing or coughing those things out, let's say into the air, or what we consider what is called droplet, without getting so technical. And those droplets now go onto the surface. So let's say a grocery in a grocery store, someone sneezes and it gets onto that surface, and then somebody goes and pick up that grocery and buy it and take it home without the knowledge to wipe that up. They are obviously trying and contacting the virus through that way, you know. So that's one way, and that is, I think it's people don't think about those that's a possible source of contamination, but I think that, you know, if anything, you know, if I'm able to bring that awareness today, you know, I'm happy to be able to do that. But yeah.
Okay, so let me ask you this one. There are two more things. So now I also heard the double mask or 3-layer mask. So just because it's already hard for you to breathe in one mask, and I think the initial masks, they're already 2-ply, and so I think I believe the one that I just purchased has 3 layers, or is he saying wear 2, like the original, and then put an additional one on top of your face? Because it's kind of hard to, and then and I know you don't want to get into name branding, but how would people know if they're getting the right 3-ply? Because that's what they're saying now, because the new virus has an additional strand that is more lethal than the original COVID-19 strand.
The talk now that's out there, what I'll say is that, you know, it shouldn't change. As the same practices that you did that kept you healthy up to now shouldn't change. So continue to wear your mask, continue to social distance. Those have been proven effective ways in reducing the virus and reducing the spread of the virus. It's, you know, wearing masks, safe distance, you know, isolate if you think you've been exposed to someone who had COVID. And then obviously, you know, you also want to boost your immunity. You know, these are times where you want to make sure that you're eating right, you're sleeping right, you're hydrating yourself right, and doing all of those things that you would do if, you know, you were down with, let's say, even like a common like flu. So it's just, just consciousness to your health practices, will get you a long way through this.
So outside of, because you said hydrate and, making sure that you're keeping yourself safe, what you were doing prior up to, but if people were not doing this, zinc is good, vitamin A is good, vitamin C is good, D is good. What else should they add to that mix?
So I would say a diet full of antioxidants. So in other words, plant-based food. You definitely want to be eating plant-based, a portion of plant-based food in your meals every day. You want to have a portion of plant-based food in your meals. So that includes like vegetables, garlic, ginger, just fruits, fruits and vegetables. And the reason why is that they contain high antioxidants, which help boost your immunity. So that's is very helpful. Also too, what I do encourage is those deep breathing exercises, just as a habit of doing them, because one of the advantages of deep breathing exercises is that it stimulates your vagus nerves, and your vagus nerve actually controls your immunity. So by just doing deep breathing exercises, you're actually boosting your immunity as well. So those are just simple things that you can do on your own to boost your immunity, and those are just natural things. So just deep breathing exercises, eating antioxidant food, so that's plant-based food. You want to be resting, you want to make sure that you're drinking a lot of water, you're drinking enough water. For females, at least 3 liters of water daily, and for males, even a little more than that, and then, you also want to make sure that if vitamin C, I do encourage vitamin C as well, only if you need it. So when I say only if you need it, a lot of us, we take vitamins when we don't need it, So in terms of like acute illness, I do encourage vitamin C. So let's say, for instance, if one is down with a virus or just even a simple cold, then I'll say, okay, take the emergency vitamin C, which is the emergency dosage is 1,000 milligrams. You can take that up to 3 times a day. I don't usually like to, I tell my patients not to exceed, if 2-3 weeks, that's good, because after a while, we see a lot of patients taking so much vitamins that they don't even need. And that also, excess of anything is a problem, so we see problems of people taking, we've had patients who come in with a lot of problems associated to excess of vitamins.
Right. Hey guys, we're going to take a quick break and we're going to be back with Essie. She's got a lot more that she's going to share with you guys on some preventative measures that you can take to avoid as much as possible contacting COVID-19. All right, guys, after this commercial break, we'll be right back.
Swing Into Their Dreams Foundation presents the golf tournament of the year, raising scholarships for aspiring National Golf Club in Milton, Georgia. The inaugural HBCU Swing Into Their Dreams Charity Golf Tournament. Registration and gourmet continental breakfast begins at 8 a.m. and shotgun at 10 a.m. Award reception follows. Come enjoy a day of jazz, mimosa, cigars, cash bar, silent auction, and more. For more information, contact 770-686-71 Their Dreams. Don't miss it.
Welcome back. If you guys are just tuning in, I'm Sandy White from Simply Fit, your #1 health and wellness cheerleader. And we just took a quick commercial break, and I hope you enjoyed Swing Into the Dream. So we're going to be asking Essie just a quick more questions about preventative measures for COVID-19. And we left off, I wanted to jump in real quick. I don't know if you know about this or if it's on the CDC website, but I know I've been seeing a lot of commercials saying that they have been approved. These are the air ventilation units that they're saying are supposed to, I guess, take out the virus from the air, things like that. Is that information where people can find that on there? Because we don't want the consumers purchasing things that really aren't going to assist them. And I want to direct them more towards CDC guidelines, because that's really what they're asking us all to adhere to. Is that a good policy or practice?
Sandra, great question again. As far as the ventilation is concerned, this is because COVID is still pretty new and these things are still being tested. So I cannot advocate for one over the other. I would say, if, go according to the guidelines. If research has been done towards a ventilator to say it's effective, then hey, look at the numbers and statistics. But I can't really make any comment as to what ventilation system to get, other than, open your windows. If your place needs to be vented, open your windows, get natural air and vent your place out. So yeah, I can't comment to that at this time, because it's
so can you give us at least 5 simple practices that people can do to shorten their recovery time if they come down with COVID-19?
Yes, definitely. And we kind of touched over that already as well. So I would definitely, to kind of summarize it all, is 1, plant-based foods, 2, breathing exercises, 3, you want to make sure that, if one is down with the illness, make sure you're moving around. Don't stay immobile in a certain environment. You want to make sure that you are moving around, and then also you also want to make sure that you are getting enough rest, as we covered before. You're hydrating yourself. You're boosting it. Basically things to boost your immunity will carry you through during times to prevent, or will carry you through those times if you're down with the virus. So that's the summary of it. Boost your immunity.
So now these tips will work with someone best for an individual that does not have underlying medical conditions. Yes.
So it will work for either or, so people with underlying medical condition versus, the healthy ones without no medical condition. These are just practices that we should already be doing anyway. But if you're down with the illness, it's basically what you're doing to support your immunity that really will help you through that period. So we have seen patients who, they barely have symptoms, and then we've seen patients who really have severe symptoms, and all of that depends on their comorbidities. So what I mean by comorbidities, meaning what their underlying health issues. So in terms of like COVID, when we say COVID-19, everyone knows what COVID-19 is, right? So it's COVID coronavirus disease 19, which was first identified in China in 2019. And this virus, the reason why it's different also from other viruses is that it can cause death. So this is not something that we, it's like the flu. We should really take this thing very serious. But it can also, it goes from mild to severe cases, and severe and even death. So in terms of like, going back to, your question, what can we do to kind of shorten that duration is really what you are doing to boost your immunity, because it's a virus, meaning, it's really so what we call, especially for my cases, supportive care. So what supportive care is that, what are you doing to boost your immunity? We treat those symptoms. We treat, like, let's say, pain, we treat the fever, we treat the cough. But in more severe cases, that's when obviously you need hospitalization, and then we can treat with other things like, antivirals, steroids, and things like that. So on your own, with people who are not that severe case, there's not a severe illness yet, or you're not severely ill, what we can do at home in terms of managing our symptoms is obviously, yes, if you're in pain, take Tylenol for pain. If you have fever, take Tylenol, Motrin for your fevers. But in addition to that, you also want to be boosting your immunity, because it's obviously your immunity that carries you through this. So, and those are the practices that we just talked about, the 5 practices. So, plant-based diet, drink water, make sure you're getting enough rest, do your deep breathing exercises, and what else? I think that's about 5. Is that what we mentioned? 5?
Yeah.
Stop counting.
But I have a question. I always got questions, but I do agree with you, plant-based. I was telling folks to at least have one meal a day that's plant-based, but now it needs to be more often. And I don't recall if I saw that on the CDC website or not, but is that being recommended more now that people have, convert their dietary needs to more plant-based? Because animals are possibly catching it. And then the last one, just piggyback off of that, because we're down to the last couple minutes, and I know I want to get as much in as possible. We have less than 7 minutes. Should folks get the vaccine? And I know right now medical professionals are getting it, but if there's an opening, should they be getting it? And then I know they need to follow up, I think like 3 weeks later. Touch on that, because I know it's a lot of back and forth. Folks are not being able to do their follow-ups if they're able to get it. I know I haven't, and I'm not in the medical. So the plant-based, and is it reason being because animals may be getting it, and then the vaccine, getting it, and then follow-up?
Okay, great question. As far as animals are concerned, getting COVID, there's little statistics to support that. I know they have reported that, some dogs that have gotten COVID, but it's really rare as of right now, there's no statistics supporting that animals are actually catching these diseases. So that's not the reason why I recommend plant-based diet. I'm recommending plant-based diet. It's not to say don't eat meat. I'm just saying in addition to have a plant-based diet. And the reason why is for the antioxidant benefits in plants. As far as the vaccine is concerned, definitely I would recommend that we take the vaccine, because at some point it becomes almost like a civic, it's almost like you could see it as a civic duty, because it's no longer about us. It's about the other people, because we don't know how the other person is going to experience COVID. So some people experience very mild, and some people it's very severe, and some people even death. And that's the reality of it. So let's say if I don't want to take the vaccine, and I get COVID, it's not just only about me, it's about the other people that I can't possibly affect, because we do not live in a vacuum. We live in a society. So at some point it becomes almost like a civic duty. So it's not about me anymore. It's about my friends, it's about my family and my loved ones, because I don't know how the others are going to experience COVID. Then the third question you asked, remind me what that third question is.
So the third one was the follow-up. They are recommending that once you get your initial vaccine, you should follow up 3 weeks later, but folks are having a challenging time getting that rescheduled because there's not enough vaccines. And then I have one more after you answer that.
Okay. I would definitely say, it is true, that there are challenges with rescheduling meeting that 3 weeks time frame. I would say just continue to follow up with the organization that's giving that vaccine, and they have their own guidelines and their recommendations. That's each one. I can't speak for that organization, so that would be the best approach, is just follow up with that.
Cool. Hey guys, we are down to the wire. We've got like less than 3 minutes. So I do want Essie to let you guys know how you can reach out to her. She did give you guys a free tool that's going to boost your immunity, which we will provide you guys with the link on that. But real quick, Essie, tell everybody how they can reach you.
They can reach me at my website at www.achemicalcenter.com. And that's again, www.achemicalcenter.com. It's full of nuggets. Go in there and check it out and get free downloads.
So thank you so much for being on the show again. This has been like really, really educational. So guys, take advantage of it. Rewind if you have to. Go to her website. And again, I'm your host, Sandy White, for Simply Fit, your #1 health and wellness cheerleader. We broadcast out of Upper Marlboro, Maryland, every Wednesday at 7 p.m. Eastern Standard Time. So again, thank you for coming on the show, Essie. And guys, we will see you next week. Bye.